So, Vanessa, I am so excited to have you here.
Well, thank you. I'm really delighted to join you today and very, excited to have a conversation just about all the things.
Well, I am too. And I mean, you're an amazing person. And I think people, if they don't know you yet, they'll be excited about what an amazing person you are by the end of this interview. But one of the things I want to start with is in conducting my research, which I always try to be thorough about, some of the events that shaped your commitment to global health started early in your days, right? And so that like the time you spend in Haiti, Rwanda, Uganda, as you're doing your training, your medical training, that was foundational to you. Can you tell us a little bit about that experience?
Absolutely. I mean, I think in some ways, my story of the work that I did actually started when I was about 14. Had a very unusual experience of being able to go to Vietnam. And it was at a time when we had not normalized relations. The US had not normalized relations with Vietnam. And the country was really frozen in time from when the war ended. And I saw a poverty and a lack of resources that I'd seen a lot in the US too, but it was very different and a scale that was extraordinarily different. There's no emergency room that you could just show up at. There's no electricity in places, there's no running water. And it really stuck with me. As a 14-year-old, I'm not sure one totally knows what to do with that, but I never really let it go. And so when I got to medical school, I realized I really wanted to figure out how to help respond to what I saw in Vietnam within the realm of becoming a physician. And so I started spending time working in Uganda and Rwanda. And post-earthquake, I went down to Haiti to help out in the ICU when I was a little bit later in my training. But what was really clear to me when I would work in these places was that that we as a global community were not helping to solve the problems in the right way. And I think a story that illustrates this is that I was a fourth year medical student working in Rwanda, and I got asked to attend the delivery of a baby because there was no physician. And so the thought was, well, she's a medical student. She's got to know something. And I sort of went into the room and there was a very experienced nurse in there, but the baby got stuck. And I sat there as a medical student realizing I was so not qualified to be the one managing this delivery. And the nurse was extraordinary, knew things to do, and we figured it out and the baby was delivered safely. But I just remember thinking, and I want to swear, but I'm not going to, but
You
how
can swear on this if you want to. We're
I'm
not
not
a
going to. I promised my children I'd stop swearing,
okay.
so I'm
Okay.
gonna really stick to that, at
We'll
least
honor
in
that. No,
public.
yeah, no tip jar today.
No tip jar. So, but I just thought how, God, this is extraordinarily messed up, right? Why is there not a physician to help in this situation? And why do people think as a medical student, I'm remotely qualified for this? And what struck for me was that there had to be a way to kind of solve for that, right? To build the capacity. And what I also realized was that so often people from what we now sort of dub the global north would fly in, deliver care, feel good about themselves, and fly out. It's like some really whacked out Messiah complex situation. And at the same time, I, went home and then was working nights as a resident. And I had a bunch of my colleagues who were working nights for days at a time to earn enough money to go abroad and to actually deliver care. And what was very, very striking to me was just, this doesn't make any sense, right? We have all these people who want to help and there's no programs to help them. And why is it that in these places in the world, people are being subjugated to suboptimal care because of where they were born? And it just seemed like there had to be a way to find a better solution. But I think I've just always felt really uh, pained and just sort of find it unacceptable that there isn't a way to kind of fix that care gap, fix that resource gap, and really fundamentally close what is deep, deep inequity in the world we're in.
Well, first of all, like, bless you for recognizing that and doing what you've done, where a lot of people like to be the ostrich and put their head in the sand. And we'll get to how you really brought this to fruition in our next question. But
Well, it
I want
turns
to
out the
start.
lion still bites you in the ass when you put your head in the sand. So
This is true. I appreciate that. Um, One of the things that you sort of touched on that is a good segue to this piece of it is you do come from a family that's deeply engaged in public service. How have your personal values and upbringing influenced your leadership style and vision for global health equity?
And I grew up in a house of public service. So, as many people do know, and I'm very proud of it, my dad is John Kerry. What is much less known is that my mom actually was an advocate for against the stigma of mental illness, depression, and really mental health back in the 90s at a time when no one would talk about it. And she wrote a book called "You Are Not Alone: The Voices of Hope and Experience for the Journey Through Depression," and actually shared her own journey through depression and really wanted people to not feel alone in that. And so the example was very much there on both sides for me. And what that did was just made me realize that if you have opportunity, if you have resources, if you have anything to give, be it time, energy, a skill set, you give it to your community, and you're part of a community and you're part of the fabric of those that are around you. And that value has been incredibly strong in my life always. I think, and it just runs deep. I mean, it's in the quietest of moments. I mean, I will remember back in one night, my dad and I were traveling together. It's just two of us. We were totally alone. And I was struggling with how to help someone raise money in Nepal for their school that was needing to be, they needed to do a whole bunch of renovations and they'd asked me for help. And I just remember feeling overwhelmed. So I didn't know where the funding could come from or how I might be able to help. And I remember sort of asking my dad, and he just turned to me really quietly and he looked at me and he goes, you just need to try because you can never turn your back on someone in need. And there was no one there to hear that.
Mm.
It was just the two of us. And I just remember, being young and hearing that and just going, okay, that's the mantra. That's what we live by. And that's what I carry forward.
Well, I appreciate you sharing that story. And so, two other things to unpack there. One of which is, fun fact, I did not know that you were the daughter of a famous set of parents. So, when I had a couple of people recommend that I interview you, so it was a pleasant surprise when I found out, oh, her dad and mom now are pretty well known individuals. And the other fun fact is, I went to UMass Amherst a million years ago, and your dad, who was the senator of Massachusetts at the time, delivered the keynote. And so I've always had a fond place in my heart for him. And so when I connected the dots, that was very cool to find out. And I guess the thing that I do want to lead to now, which I'm going to put a link to your mom's book. Hopefully it's still on Amazon so people can see that, because I think
I think it is still available. Yeah.
I would love people to get that perspective, because I would argue people still don't spend enough time focusing on mental health now. And so the fact that she was recognizing this 50 years ago, when people took the pull yourself up by the bootstraps approach, we sort of swept everything under the rug, obviously, where the chickens have come home to roost as a result of that. But on a positive note, I do want to talk about something that you founded back in 2012. You co-founded. It was an organization called Seed Global Health. And I love this because the phrase in my mind that keeps coming to me is teaching a person to fish, which is what you did versus giving a person a fish, right? So tell us a little bit more about your mission and purpose. And I have to think that the work you do now is more important than ever in light of the U.S. State Department's dismantling of USAID earlier last year, unfortunately.
I mean, Seed was born of an idea, the same thing that I talked about in terms of doing our work in Rwanda or Uganda was that, the vision is for a just and equitable and healthy world. And I think I can get all wonky about the stats of, the importance of health to the fundamental underpinnings of our society and well-being, which is why to me health is so important. But we founded Seed really with this idea that we could support our partners to build a strong workforce, because the pathway to creating that healthier world is increasing access to high quality care for all. And it is people, humans, health professionals that are the ones that deliver that care. And I am a health professional by training. And I think that, to be able to actually, whether you're treating cardiovascular disease, you're delivering a baby, you're responding to COVID, at the end of the day, it is health workers that are on the front line of any kind of response. And we see that time and time again. As the funding was cut from USAID, we were one of the only partners left standing in some of our partner countries. And so when Ebola broke out in Uganda, and everyone still carries a fear of God of Ebola often because of what happened in West Africa in 2014. But the truth is that Ebola is actually a treatable disease if you diagnose it early and you treat it appropriately. The survival rate is quite high. And so we supported the government of Uganda to help. When the USAID funding was gone, there was no one to help support an Ebola outbreak. And we supported training over 4,000 healthcare workers in order to be able to appropriately understand their own personal protection, infection control, and also sort of triage and response to what was happening and really help support sort of stopping the outbreak in the country. But what this has translated for us, is in a country like Uganda, which is 50 million, growing to 100 million in the next 25 years, they have no emergency services. So imagine that. You cannot walk into an emergency room when you are in an accident or something happens to, you have appendicitis, you're not able to go anywhere. And there weren't emergency physicians. And it turns out that over half the deaths in the country were from a failure of emergency and triage services, meaning that frontline response. So we partnered with the government to build out an emergency medicine training program. I've now trained the first 25 emergency medicine physicians in the country, when back in, let's say, 2018, there were none. And so the difference of this is really, for some people, life or death. We're seeing a drop in the mortality rate, in the emergency rooms where we're working. In Sierra Leone, where we work, where you have 50 times the likelihood of dying in childbirth than you do here in the United States. We have helped drop mortality by over 60% in the districts where we're working. In some of the places where we work, we have not seen a maternal death in over a year. So we're talking truly about the difference of life or death when you're creating that network of health workers that are available. And we're not doing anything that is new or innovative. We're literally just supporting our partner countries to actually enact the plans that they have prioritized and want. I'll never forget the Minister of Health of Malawi, when she was asked, we were at a meeting during the UN General Assembly, and she was in the UN. Somebody said to her, what is your climate and health resilience, and what is your plan for outbreaks? And she just looked at everybody and she said, my climate and health response is a workforce, is a primary care system and a workforce that can actually meet the burdens of disease. And that's what CEED's about. We're just helping to create jobs, make health professionals available to people who have them in need, transform health outcomes. But honestly, even when we can't save a life, sometimes it is as simple as having someone not die alone, not die in pain, die with dignity. If somebody who's lost their mother, that is almost one of the greatest gifts that you can give a patient or a family. And that's the transformation we're looking for.
Well, it's profound. And the more I sort of read and learned about it, the more impressed I was, because we won't mention the name of, some of the groups, but to your point, parachuting people in and out and not doing anything doesn't really fix the problem. And so the fact that you're treating it holistically, I just think is such an amazing approach to it. And it's having an effect, and we need it more now than ever. And we need more people like you and C Global doing what you're doing. I do want to get into something, and I know you shared an example early in the conversation about the, sort of young you being in that emergency room and needing to help deliver the baby, which you had no real business doing. But, you just talked about the fact that C Global's trained tens of thousands of doctors and nurses and midwives being a really important one across sub-Saharan Africa.
Yeah.
Maybe share another story or two that capture this long-term ripple effect of the work that you're doing with communities and health systems.
I mean, of course, midwives are extraordinary. And I think we have underrated midwives often in the United States, but they are a really unbelievable source of dignified and excellent care for delivery, prenatal, the whole gamut or arc of pregnancy and delivery and postnatal care. And I think we have seen extraordinary just the extraordinary impact of midwives in all of our programs. So we actually do midwifery in all 4 of the countries that we actively partner with right now. We're scaling a national midwifery training program in Sierra Leone with the goal to actually train 3,000 midwives in the country to be able to support the care for the entire population. We are currently working in 3 districts in the process of expanding farther. We have started the first ever midwifery-led ward in Malawi. So Malawi is in Southern Africa. It's the second only, I believe, in the region of a midwifery-led ward, but this was really part of the goals again of the country. So we're really in support of what country priorities are. But we've helped build out the capacity of this midwifery ward in a district hospital such that they're actually so capable of being able to care for patients with complex pregnancy now. They don't actually have to refer out that often to the main hospital for C-sections or for the big interventions. We've repeatedly heard stories of patients who, so in Uganda, there was a whole system where patients weren't going to the public health system. And as a result, people were nervous. They'd had bad experiences. They didn't want to go. But by supporting the public health system and using midwives again to provide that dignified care, we started to see the return of patients into the public system. And so they don't have to pay out of pocket to go to a private hospital anymore. They can get the care they need that can be life-saving. I just heard the story of one patient who was sort of convinced by her friend to return to the public system because the friend had had a very good experience, patient of having a postpartum hemorrhage, which is what most women die of in childbirth. But she was appropriately treated. She lived and she gets to go home to her family. Midwives, one of my favorite stories is about a nurse midwife in Malawi who was also supporting the district health office. There was a big cyclone that came through into Southern Africa called Cyclone Freddy. It was the longest and largest storm to hit Southern Africa ever. It actually returned out to the Indian Ocean and then came back in and had a second run. But it washed bridges out to one of the district hospitals where we were helping to support. And this Chansey Banda was one of the nurse midwives who realized women are not going to stop having babies just because the bridge is washed out to their facility, right?
Right.
In fact, women are more likely to be at high risk after an acute trauma or event like a big storm. And so she actually argued for the need to reappropriate and to build out a service that women were able to access. They ended up building out sort of services at a different facility. SEED supported a full multidisciplinary team that allowed for the whole arc of pregnancy care that was needed, such that we ended up, I don't remember the exact statistics, but it was something, several C-sections, a postpartum hemorrhage that we prevented death, dealt with multiple complications. It was such that no woman or child died in the period while we had to stand up this facility. That was all led by a nurse midwife. So I think thinking through these models of expanding access for health workers, providing dignified care again, really again, supporting the priorities of these countries for what is just fundamental and right has been the mission of SEED. And I think as we've been doing our work, we're starting to see the ripple effect of people understanding the power of a workforce, the power of investing in these stronger health systems, and the need for this at a time where we are in a rapidly evolving kind of series of challenges, be it a lot of countries are facing less infectious diseases that we traditionally think about, like malaria or TB or HIV, and seeing rises of things like heart disease, lung disease that are actually creating this double burden. And so by training a workforce, we're better able to support these countries through that epidemiological transition, it's called. But we're also in a climate crisis. Climate change is driving increased health burdens at a massive scale. We're expecting millions of deaths from climate change now in the coming sort of 25 years. And the only way we're going to manage that and stabilize it and respond is if we have the ability to have resilient health systems and workforce to manage all that disease. So we see ourselves on the front line, but we're starting to see others catch up and realize the importance of it.
Well, I like that shift you made. And by the way, I think one of the hard things is, and I loved your response to this, that a lot of people don't know where to start to help some of these huge problems. So they do put their heads in the sand. As you mentioned, the lion can still bite them in the ass. So I love that you're systemically thinking about this and how do we start to chip away and build up the foundation to show people that there's a way. But the thing that you just touched on that was another thing that really struck me about the work and the way you look at things, and we'll get to what position this led to and a couple more questions as well. But your work highlights something that's unique, which is called health as an investment, not a cost. And I don't think a lot of people think about it this way. How do you persuade finance ministers, international donors, and long term health workforce investments to yield and help secure these dividends? And maybe I know that doing some of the prep, I saw some facts and figures, but like what impact does this have on the world? Totally fine if you nerd out here.
Oh, I love to nerd out. And I think the statistics are pretty stark. I mean, just to give an example, extreme heat in the United States is costing us 100 billion in productivity today, and it's going to be 500 billion by 2050. Oh, and we know that countries that have increased health burdens actually see um, lower GDP, better health, better GDP growth. And we're seeing certainly how there's very direct costs in certain industries. When you see worse health, you see decreased productivity, absenteeism. People aren't as accountable to the work they're doing because they're sick. On a household level, there's a study I love that is that when the main breadwinner of a house dies of HIV in Lusaka, Zambia, this was a study that was done by the UNDP, about 2/3 of the household lose 80% of their income. You have 60% of households that actually lose access to running water. 40% of houses have to, sorry, it's 40%, 60% of houses have to move to cheaper housing. 40% of households lose access to running water. And about 17% of boys, 17% of boys in those households stop going to school, and 21% of the girls stop going to school. So those ramifications of not going to school have lifelong for your income earning and
Mhm.
potential. So that's a really real example where poor health and death actually has very direct impacts on the income of a house or the ability. We see this in the United States. When you are sick with a lung disease, or are getting affected by air pollution, or your kid gets asthma and they can't go to school and you can't go to work, that is a direct impact on our income. So health has actually got microeconomic for these household level costs, but they also have big macroeconomic on the cost of what is happening for an entire country, or for a community or for a city. And I think the hard part is we also know that there's savings. So you can actually save money. If we prevent bad health, you can save money, you can see better income. We certainly save on insurance premiums and rises in costs there. But how do you translate that for a government that's running on a 4-year election cycle? Or how do you translate that for a company that's got to report to shareholders? And I think that's the challenge we're facing right now, is how to take that income that we know is really real, but be able to incentivize those that are in a position to create behaviors around health and change health at a policy level to do that. And I think that's a really important piece of work. There is, you invited me to nerd out, and here we go. There is some very interesting programs that are happening right now, actually, where the World Bank is leading on an effort with the WHO, the World Health Organization, and the government of Japan, called the HealthWorks Leaders Coalition, which is an effort to put 1.5 billion to have increased access to care. It's getting executed pretty precisely through about 21. The first step of this is 21 countries are committing to country level compacts, which means that you're going to invest in the health system as a pathway to development, pathway to climate resilience, a pathway to job creation, because this is jobs. Turns out that the health sector is one of the most resilient sectors in economic downturns. So we're talking about something that can actually continue to be productive, continue to create jobs, as well as deliver better health for people. It's a win-win-win. So some of this is about educating and making people know that data and to understand, which is like the health ministers. Some of it is getting new data to help people really make the connection of what is the 2 to 5 year return that matters for shareholders or for governments that need to get elected. Some of it is just a value shift. Somewhere in this world, we have to decide that we actually want our human experience to be better. Now, I can go crazy down another nerd fest on the well-being agenda and how you design budgets for better life. But I think the simple thing I would just ask people is like, why are we on this earth? Right now, many people seem to think it is just for the pursuit of income, money, and wealth. At the end of the day, when you are on your deathbed, do you have family around you? Did you laugh enough? Have you experienced what it means to be part of a community and be kind? There really is an experiential quality to life that matters, and health is foundational to that. So I think that we are also struggling right now in this moment in time of who do we want to be as a human population? And I think it's all the more important for us to roll up our sleeves and to bring forward some of these powerful pieces that actually link all of the goals, right? You are healthy, you are wealthier. You can have both. And that's been a big part of the work that we're doing at Sea, just thinking about how can we invest ourselves, bring our deep experience in the work that we're doing. That story of Chansey Banda and what she did in Malawi, that woman in Uganda who sought care and got saved in postpartum hemorrhage, what is the ripple effect of that? And I think if we can capture that more and better, we can begin to have some of this impact. But we're starting to see this shift happen. There's a group coming out being led by President Mahama of Ghana that is pushing for African countries to prioritize investing in health as a pathway to development and stability. That momentum, I think, is going to catch fire, and we're going to start to see a big shift.
Well, you touch on something which is a problem here, and you've actually been sort of put on the front line in rebutting some of these. We won't get political or name names, but
We can always get political.
we can always get political. There is a certain agenda that's being put forward and has been for a while, but is particularly strong right now about the fact that climate change is a hoax. And so one of the things that I was thinking about as I was getting ready for this is, how do you deliver that message? Who is the right person? And I feel like in some ways, we're fighting some of the same battles we did during the pandemic, where you had the people that were like, vaccines are good, they will save us. And other people are like, no, this is a conspiracy theory by the government to try to control you. So how do we, who's the right person, and how do we break through and get people to understand a lot of these very factual scientific things that you've shared, which if you sit down for 2 seconds, they kind of make sense?
You're asking a very important question. And there's a lot of folks that are thinking very hard about what does this look like. I think one of the biggest challenges we're facing today is communication, because social media and the various ways that news are delivered and facts are delivered have created really real silos. I mean, I don't know if you remember when Kellyanne Conway famously said there's alternate facts. We all laughed, but actually she coined something that is very real. We live in a world of alternative facts, and people are in different worlds of facts, and we're not connecting on that. And I think so. I think who delivers it matters, because people listen to different voices. But I also think I think we do need to think about the different actors that are involved in this. But I think it's actually, in some ways, it's also fairly simple, right? A colleague of mine who used to lead the WHO's climate and health unit famously got in we won't call it a fight, we'll call it a debate with a very conservative minister from a European country. And he did not believe in climate change. And so, at the end of the day, whether you believe in climate change or not, it's here. So again, it's that ostrich in the sand concept, right? But she asked this minister, she said, well, do you want your constituents to have clean air? Of course I want them to have clean air. Do you want them to have clean water? Of course they should have clean water. Do you want them to have access to food and not be malnourished and to have, resources? Of course, of course. She said, well, then you are the biggest environmentalist of them all. And I think sometimes just making that bridge to understanding what we're really facing or what that connection can be is really powerful, to help people sort of simplify the language that we're sort of dealing with, and understanding where there is actually deep sort of shared purpose, right? The famous rules of diplomacy are to listen and to understand what is driving someone and to find that shared purpose. And I think that in the case of climate change, we are really affected by it. Extreme heat is actually an area that people can agree with, right? We can't avoid it. We all feel it. So sometimes you got to just start in the places that people do understand and can feel. But I actually honestly think this is going to be a massive problem in terms for those that are climate deniers, because as we're seeing changing resources, as we are going to see food sources change and prices go up, it's going to be an issue. You look at the whole IRA Act and sort of what the Inflation Reduction Act was intended to do. It was actually sending billions of dollars to red states, which are traditionally climate denying states. But the reality is that those billions of dollars are now going to go away. That is not going to serve well for those that cancel the IRA. Interestingly, right? We just canned oil in Venezuela, or we just went into Venezuela the oil companies are not jumping to go to Venezuela because actually fossil fuels, the markets are actually telling us that fossil fuels aren't as important now anymore. And so I think it's about just being a very, I think the truth always comes out. It will declare itself. Hopefully it does not when it is too late. But I do really believe that we are in a place where, you know, though we live in different worlds of facts, facts are still facts. And I think a great example of this for me was working in the COVID pandemic in the ICU. We had lots of vaccine deniers at that time, and it was very painful. And I remember when many patients that came in who had said they would not get a vaccine, they did not get a vaccine, and they came in really sick with COVID, and we would be standing at the bedside about to put the breathing tube in them, and they would be begging for the vaccine because they suddenly saw the truth because they were living it. And when you were living it and you were sick and you realize you made a mistake because you were misled, your mind changes, right? We're living that every day with climate. And it was too late for them to get the vaccine. And that was the most painful part, was having to look at these patients and say, vaccine's not going to help you now, right? We had a patient who was pregnant who denied a vaccine. That was her and her baby that we were proning in an ICU, which means going face down and having to adjust, and really try to bring her through the moment. So the truth comes out. It will come out. My hope is we can find ways to communicate that truth before people get hurt. But we're in a real moment of sort of disruption around that, right? Measles, all of it.
Yeah.
And I think it's been very painful to sort of watch what's happening as a physician and to watch people be put in harm because they're being given mistruth. But I think we have to be thoughtful about the language we use and who conveys. And I think there is a pathway forward.
Well, I think you hit the nail on the head, because one of the things at my previous job, living through the pandemic, we were a healthcare marketing and advertising agency. We did really try to stress that empathy and understanding why people are vaccine deniers, which I think is the same as today. And it's hard and it's frustrating and you see the impacts, but poking people in the eyes, it's like I joke with friends that are on Facebook and want to make their arguments. I'm like, you're not convincing anyone. You're either polarizing or you're reinforcing your own message, which maybe that does it for you, but you're not changing hearts and minds. You really have to dig deeper. And I appreciate the fact that you're doing that.
I just taught a class of med students, and this question of how do you get people to understand what we're up against came up because we were talking about the climate chart and where we are actually currently on the trajectory for at the end of the century, where our policies would get us if we actually adhered to them, and where we actually need to be. So we were having this discussion, and I sent them out with an assignment, which was, I want you to talk to somebody with an opposite opinion. Don't have an argument, but have a debate, and start by listening. Because I think that we've lost the art of sort of compromise and finding our path to consensus.
You hit the nail on the head right there. And I've had this thing with my kids who are almost 27, 24, and 18. I'm like, I will debate you on anything, but it's going to be a debate. And what I need you to do is I need you to be facile enough to argue both sides. Because if you ever want to win,
Totally.
that's how you have to go about it, is you have to be in that other person's shoes. And I spent a lot of time growing up doing that very thing, sometimes with my dad, sometimes with friends, but it served me well. We've been dancing around this a little bit, Vanessa, but in June of 2023, you were named the first ever Director General Special Envoy for Climate Change and Health to the World Health Organization, the WHO, which you had mentioned earlier. Quite an honor. Congratulations. Tell us a little bit more about what this role entails. And I think you've hinted at it in some of your answers already.
The role is really designed to help support the understanding of the intersection or the ways that climate and health are deeply linked, and to help really accelerate climate action through that understanding of health. Because I think people do personally feel when they can't breathe well, or when they have people are having heart attacks from what's happening in the climate and pieces like that. So trying to really build that awareness and understanding and to incite action. It's been an honor to work with the WHO and to really support this agenda. We did help to create the first ever Day of Health at COP28, which really put climate and health on the map and deepen that understanding. We've been working with the last 5 COP presidencies, so the Conference of the Parties for the UN Framework on Climate Change Convention. We've been pushing all five presidents really bring forward a health agenda so that health is always appearing and understood and being really engaged by countries, and trying to increase the understanding of the link between climate change driving disease burdens and those disease burdens affecting us economically and from a security standpoint. For example, we may want to forget COVID, but we have an over 50% chance of another COVID-like pandemic in the next 25 years, and it's being driven by climate change. The main mechanism of these outbreaks is animals to humans, and we're expecting to have 4,000, events of crossover from animals to humans just, in the next sort of 70 years. So we're looking at really high risks of these things happening, which means then what are we thinking? How are we going to respond to it? How are we going to build our resilience to those moments? How are we going to think about what we can do about it? And so we've been trying to really increase that awareness and help people understand, one, there is a problem, and two, there's something we can do about it. And what we do about it should be to be investing in the resilience of health systems to respond to this kind of urgency. And I think very few people don't understand that there are more people who die from air pollution a year than we have lost in the entire COVID pandemic to date. That's in 1 year from air pollution, more than in the last 5 years from COVID. And I think when you think about that, it puts in perspective a little bit what we are dealing with in climate and health and the need to be proactive to respond.
It's a staggering number, yet we worry about people getting attacked by sharks, which I think kill maybe like 3 people a year globally, 7+ billion people. But
I
I
think climate
digress.
change is increasing that interaction, though, unfortunately.
That's a fair point. Last question, then we'll get into some lighter, quicker questions. But balancing roles as a clinician, professor, I believe you're at Harvard, right? Doing some important things there. The WHO, a WHO envoy, and a parent, which we started in our pre-conversation. These are very demanding roles. What strategies keep you grounded and effective across these different leadership and parental areas?
Man, if I'd figured that out. So I think, one, you have to so I think number one, family comes first. My children come first, husband comes first, my parents, there's the whole other element too, right? If you are spanning generations, family comes first. And I not only believe that, but I make sure my whole team can live by that too, because it is how we make ourselves whole, then we're better at what we do. But I think, from that next piece is, just to, you also have to make choices, right? I actually am no longer clinically active and haven't been for a couple of years because I couldn't be a good ICU doctor in the way that I wanted to be, travel for work, to build seed and to have the impact of having trained 47,000 healthcare workers and try to push some of these big agendas for people to do the right thing and be there for my kids and do it all. And so I had to make some hard choices around that. And so I have an incredible, some of it is having faith in people and delegating and really trusting. And the seed team is incredible, right? I mean, they are out there killing it and I'm learning from them all the time. And so, sorry, it's not a great phrase. Maybe we should re-say, I'm not saying they're killing it, but in the sense that they're really mission driven and the team at seed is really mission driven and they are deep believers and they have so much knowledge about where we're working, what we're trying to achieve. And so we have really built a giant family working in concert that talks openly, honestly, about what we're doing. And I think it's being forgiving to yourself, right? I mean, those moments. I recently was late to pick up my daughter and managed to blow my tire on a curb in my effort
No.
to make room for another car to get through. I mean, right? And you sit there and you're like, if only. But so there's something that's about just the humanity of who we are. But I don't think I'm any different than anyone else. I think I'm just believe in what we're doing, get the privilege to work with a really outstanding group of people who I learn from all the time. And, just figure out what the family needs and start from there.
I love that very human message. So thank you for being real. And I love that you are family first because I think there's a saying which you never end up on your deathbed sitting there thinking, I wish I spent more time working, right? It's, what legacy did I leave and what does my
I love
family
my
think
work.
of me?
That may be part of my equation too, but my family is important.
It's part of your baby, right? And the couple of people I've met at Seed are fantastic. So I can endorse that. I do want to get into some quick,
With
final
sense of
questions.
humor, you have to have a sense of
Yes.
humor. Oh my gosh, sorry.
I mean,
That's
that makes the world go, a lot easier if you do have a sense of humor about things. One of the things that I want to find out is, what makes the people that are on the show tick. And so one of the questions I'm asking now is a book, a podcast, or, anything that currently has your attention. It could be a show, something that's maybe a little bit more on the frivolous side versus a deep documentary or a very serious business book.
So I've just gone through the Abir Mukherjee series of Sam Windman, which is really good. It's on peri-independent India, and it's
Mhm.
murder mysteries. So you get lots of interesting commentary that goes alongside with the plot. And I'm watching Landman right now,
So I have to ask you,
which
because I love Landman, but it's getting some criticism that maybe it's lost its fastball a little bit. Have you felt that way, or have you enjoyed it just as much this season as last?
nope, I would have to agree with that. I think it has gone a little bit off the rails this season. It's lost, which has been where, we're finding ourselves fast forward through various parts. And so I'm a little frustrated, but at the same time, it's a really interesting commentary on various different pieces of the world. And so it's been interesting to watch.
Yes. And, there's a narrative that Taylor Sheridan may not be able to balance writing for 7 shows at the same time. But I will say season 1 is a must see, and I've enjoyed
Well,
season 2 even
Yellowstone
though.
did the same, right?
Yes, yeah, you're right. So thank you for answering, and thank you for being honest about those. I appreciate that. This is one I'm really curious to learn more about, because a lot of the guests on the show have this opportunity, but you've had a chance to meet a lot of amazing people. Who has impressed you the most?
Who has impressed me the most? This is probably going to be not a satisfying answer for anyone. My kids. I find it a just gonna swear again, like a really surreal miracle that these children were born and grow and are who they are, and as a scientist and a physician who, really understands how the human body, this whole process works, it's really always just an unbelievable thing to watch them evolve and grow. And so from it like that, not traditional impression, but really being sort of impressed in that emotional way, I am really sort of just very, very struck by watching these two children emerge.
I love it.
But
That's a very
to your
refreshing
other
answer.
point, I've had really unbelievable chance to meet a lot of people, and you're never going to meet me choose. But if I had to pick one of the like that other one, and I never met him, but I was in the vicinity. I watched Nelson Mandela speak in Trafalgar Square in 2005. I was part of the crowd. I was studying in London at the time, and I was so unbelievably struck by his ability to make you feel that you were able to be an agent of positive change, and to do that across an open forum to a crowd, and to really create a sense of human accountability of who we are to this planet, this earth, and these people was deeply profound.
That's a good one. I mean, him, MLK Jr., Gandhi, they're all right up there in terms of top 5 of maybe the most impressive people in all of humankind. A little bit of a heavier one, but biggest regret.
Not going to satisfy you here either. Uh, because my biggest regret right now is probably not understanding how profoundly social media is actually impacting our younger generation. And I feel like I am on catch up mode as a mom right now with my kids. Because I personally, am, well, I think it's just very difficult to watch children and, not trying to figure out how to create limitations, but so much communication happens for kids between social media. How do you create natural habits and history and boundaries around our use of technology and protect their mental health? And I think this is one of those things where we're going to look back in 10 years and say, oh my God, I wish we understood the way we're now sort of looking at cigarettes. And I think we're really behind. And so my regret as a parent right now is not being stricter than I've been. And I feel like I'm playing catch up. We've gotten very strict. We just got this amazing device called a brick, which actually shuts your phone down. So turns out Snapchat evades all parental controls for downtime. It's terrifying, to the point where we have downtime on my son's phone. We picked it up. I picked it up one morning at 5 a.m. where the whole phone's supposed to be shut off. Snapchat's the only app that is up and running. And I've done all the blog reading and all this. The brick, though, has shut the whole thing down. And my son actually looked at me and he goes, God, I actually like not being able to have to. So these children are really young, right? They're impressionable. They don't have the guardrails yet of their life. And if we as parents aren't protecting them, but I've been behind and I am really regretting that because I just am feeling like it's harder to claw back and to really protect my son. And, we're ahead of the game on my daughter at least.
Well, I think it's a good one. And I think we all feel that way as parents. And you don't want to be that parents that makes your kid feel like they're a dork or, not fitting in. But at the same time, you're right. That same idea of smoking, your parents my parents, early days smoked around me in the house, in the car. You didn't wear seatbelts and parents drank, moms drank when they were pregnant. And you're like, how could you possibly have done that? But they didn't know. Right. And so I think you're right. We're going to end up in that same place with social media.
I have one more for you that I'm sure will go a little bit more. I actually don't regret it, but it's one that maybe I will one day. I had a job after college where I took pictures of pets with Santa Claus, and I had to wear a Santa hat and a squeezy toy. And I vacillate between whether I regret that one or I wear it with a badge of pride. Um,
If only I could dig that one
one of
up
my higher.
online and use that with our post.
I
I
am
won't do that, I promise. But
confident my family took pictures because they brought the dog down for a picture pretty much every day. I'm sure there's one somewhere.
all right, well, we'll send people on an Easter egg hunt on that one. All right, last two questions. Which band or artist, ideally one that's no longer around or touring, would you most like to have seen?
Oh, that's easy. The Beatles.
That's a current sort of theme, and I'd say probably like 25% of the guests have mentioned that, and I feel the same way because why not?
I mean, I grew up hearing the Beatles, and my father has been. So I think I'm funny in some ways. I am a child. I'm a once removed by the '60s because my father. I grew up with Vietnam very heavy in our house. My father, my mother's two brothers were all in Vietnam at the same time. So the kind of shroud of Vietnam was part of our house growing up always, and the '60s and that whole time and experience. And it's hung very heavy for not in a bad way, but it's just been a part of our lives. And so the Beatles for me they're part of that. So I think it's and that was where the areas of joy, right, in that period. And so
Hmm.
that question, the Beatles.
That's a good one. Last one, and this is a little bit self-serving, but where can people read you, engage with you, and help if that's a possibility with Seed Global Health?
Self-serving, and I love it. People can engage. Obviously, they can learn more about Seed at our website, which is just seedglobalhealth.org, Seed being SEED. We have an Instagram that one can follow, Seed Global Health. I have an Instagram, VB Kerry. We can be found on LinkedIn, both, Facebook, both. I personally am off X, but I think we've sort of been later on that, but we would really encourage people to come be a part of our journey and to learn more about our work and um, really excited to have conversation and dialogue and think about how we all can help meet this moment.
Well, Vanessa, thank you for a lovely, honest, fun, scary conversation. I appreciate just how
Only
authentic you are.
optimistic. It's
Only
not
optimistic.
scary. It is
Yeah.
only the sharks might be scary, but I am nothing but optimistic.
No, you are very optimistic. I think it's just there's a lot for us to tackle and it seems overwhelming at times, but I love that there are people like you in the world that are helping to simplify it and do something about it and show us the way. So I appreciate you.
Thank you so much. It's really a pleasure to be on the air, and I'm very grateful for your
Of
covering
course.
all this.
Of course.